not directly, maybe indirect cause of thing, because there are some hormones released. So the stress has related to some hormonal imbalance that may have correlation with some sort of a breast cancer, colorectal cancer. So because that leads to the other allied diseases, and then that may lead to cancer. But it's related indirectly, not directly. Once in 3 months is what is the recommendation. So you need to know the methods. You can just Google it, how to self-examine the breast. There are two methods. One is circular method. Another is a longitudinal. So the idea behind these two is to not to miss any quadrant of the breast. So also the armpit. So you need to examine in circular way all the aspects, all the breast quadrant as well as the armpit. So that's very important. You can find the images on either YouTube or on the Google, so that you know how to examine correctly. Oral contraceptives, earlier oral contraceptives used to have a lot of estrogen. So anything which is more estrogen is more prone for development of a breast cancer. So that was an earlier notion. Now the contraceptives which have come up have a balanced estrogen-progesterone, so they are not that there is not much of a risk attached with the newer contraceptive that we have. Breast cancer surgery, we probably divide them into one: the breast conservation and the total mastectomy. That completely taking out the breast. So what happens with this is the psychological. One is psychological, but it's a mandatory treatment. If the patient has a localized breast cancer, it's definitely a part of the treatment to cure that particular lady. So there are a lot of innovations. Though I'm not a surgeon, I'm a medical oncologist, but surgical oncology innovations there are a lot of advancements where even if they remove complete breast, they can reconstruct it. So even including the nipple area or complex. So that innovations have probably made us they made a lot of women psychologically they become better, because if they reconstruct, there is a reconstruction of the breast, and the reconstruction is almost as good as it was earlier, then the psychological aspects can be kept at bay. So that's one innovation in surgical oncology area as well. Yes, some of the breast cancers run in families. That's around 20% of the ladies. So in 20% of the patients, it's done in families. So somebody is positive. So we have a study from India. One of the author is me as well in the breast cancer. We have published that data of family incidence in Indian women. So it's around 18 to 20%. So a mother is carrying that mutation called BRCA1 and BRCA allied mutations. There are 13 more mutations which are there. If they carry any of these, there is a chance that 50% of their progeny may have harboring of this particular mutation. So if there are two kids, each one have 50% chance of getting this mutation. So overall in the population, it is 20%. If somebody has a BRCA mutation like Angelina Jolie, so their progeny has 50% chance of transmission of the disease. And if they carry a mutation, the breast cancer incidence is to the tune of almost 80%, and ovarian cancer is to the tune of almost 40%. So we have advocated, some of my patients have undergone prophylactic surgeries for the breast as well as the ovaries to prevent the occurrence of the cancer. In India, as we know, you also agree with me, a lot of our ladies would not come out when they have small lump, unless in a metropolitan cities. In a lot of other tier 2 and tier 3 cities, unless it's a big lump, they'll just hide it. So obviously in India, we see a lot of advanced diseases compared to West. West, they are very well aware of the screening modalities. They're very well aware that yes, the small lump needs to be evaluated. Hence, we see early stage. This is more common in the West, whereas in India we see a lot of advanced diseases because of the reason which I told you.